ever wondered what makes your scalp? Well, your scalp is made up of 5 layers. Using the mnemonic scalp, you're going to have 1. The skin, 2. The deep cutaneous tissue or the subcutaneous tissue, 3. You're going to have the epicranial aponeurosis, 4. You're going to have a loose connective tissue, 5. You're going to have the pericranium, and then lastly, you sit on your cranial bone. Let's take a look at the skin. The skin of the scalp, it is richly vascularized, good nervous system, abundant sebaceous sweat glands, as well as hair follicle. It has a good healing capacity, but it can be affected by what you call sebaceous cysts because of its abundance of sebaceous glands. 2. Your deep connective tissue. Your deep connective tissue, it is deep irregular connective tissue. It is actually a site where there is anastomosis of your branches of the internal carotid artery and branches of the external carotid artery. 3. The epicranial aponeurosis. The epicranial aponeurosis, or the Galea Aponeurotica, it is a part of a muscle called the frontalis occipital muscle, which extends from anteriorly to posteriorly, attaching to your supranacal line. This layer, the first layer, the second layer, and the third layer, which is the skin, the deep connective tissue, and the epicranial layer. This layer, they are referred as the scalp proper. These are the layer that moves as a syncytium. They are very important. Lastly, you're going to have your loose connective tissue. Your loose connective tissue is the dangerous area of the scalp. Why? Because it's going to have veins. You have what you call a mesoid veins. These are mesoid veins. In mesoid veins, these are valveless veins that connect interdural veins with extradural veins or superficial veins. So infection of the loose connective tissue will lead or will spread to your intradural venous sinuses. For example, this is your superior sagittal sinus. And then the last layer is going to be your pericranium. Remember, every bone is surrounded by a periosteum. So the cranial bone, right, is a pericranium. This pericranium in areas around the sutures, and it attaches to the cranium in areas around the sutures, and also attaches to the foramen, continues as the endocranium via cranial foramens. You understand? Right. So this is everything that you have to know as far as the layers of the scalp are concerned. Thank you so much. You have a blessed day. See you next time.